Good afternoon. Today we are showing proper donning and doffing for a high consequence infectious disease patient if they present to your emergency department. We have our trained observer with the checklist, and we have our individual who will be donning and doffing.
So first you're gonna gather your checklist from your binder as the checker. Then you're gonna gather your supplies. We are gonna inspect the PPE. We are gonna look for knee-high boots. We are gonna look for gloves, a surgical gown, an N95, a tie-back hood, a apron, gloves again, face shield, and that's it. So before we start, we need to make sure you go to the restroom and remove all personal belongings. Clear to go. Sounds good. Now we're gonna start with your knee-high boots. The toe point should be up in the front. You are now gonna hand sanitize your hands, disinfect your hands. You are gonna place your inner gloves on. You are then gonna place your surgical gown on. I can assist you. Tie the inner and tie inward. You are then going to want to make sure that there is no gaps between his pants and his boots. Make sure it's tucked in.
Different size gowns will be available on our PPE cart.
You're going to now place your N95 on. You're going to make sure you have a good seal. Good. Now we're going to put on your hood. For girls with ponytails, you want to make sure that when you tie it, that your hood, that your ponytail is low and does not make the hood go up. You're going to check your N95, and it is still good. You are going to then place your apron on. You want to make sure you tie it. You don't tie it too tight because they will need to be able to rip it off at the end. Make sure your seal is still good. Then we are going to put on your face shield. The face shield should go across the brow and not obstruct. Turn. And we are then going to put on the last outer gloves. You will need a new pair of gloves if they rip. They need to be the extended cuff gloves to make sure that they cover the wrist. Some places will have the extended cuffs like this, some will have the ones that look more like our sterile gloves that we see on the regular basis. You are now ready to enter the room.
So now the person is done, they're coming out. Now we need to doff. Doffing begins in the room at least 3 feet away from the patient.
With a red trash bag, not clear like we have here. You are going to start with inspection of your PPE. The person is going to make sure you don't have any smuts or anything else on you. If you were to have anything on you, you would then take purple wipes or bleach wipes that are in the room. You would do a 1 swipe and into the trash. You do not rub or smoosh around. You would then disinfect your outer gloves and remove your outer gloves into the trash can. You are then going to disinfect your gloves again. You are now going to discard your apron. You are going to pull from your shoulders and rip down and away from you and roll. Pull with your thumbs at your waist. That's why you can't tie it too tight on there.
Too tight.
Too tight? It's okay now. It should be in the, I just did it. There you go. Disinfect gloved hands. You are now going to remove your face shield. You are going to lean forward, pull over, and into the trash can. Next, you are going to disinfect your gloved hands.
There might be the one on the wall where you go like this, but
Yes.
for demonstration purposes, we're going to use that.
You are next going to discard your hood. Same thing with your hood, you're going to pull from the top and down while leaning forward, not to contaminate your face. Now you are going to disinfect your gloved hands again. You are now going to remove your surgical gown. You are going to pull again from your shoulders, ripping down and away from you, and rolling forward. Disinfect your gloved hands. Now each facility has a different yellow area that will be marked outside of the room. So now you're ready to exit the room. Before exiting, you are going to make sure that you have your N95, your gloved hands, and your boots remain on. You are going to come outside the room to the yellow area with a chair.
And another red garbage bag.
And another red garbage bag. You're also going to then disinfect your hands once you are outside. You are then gonna start with the foot closest to the green area by going inside the boot and down. And then that foot will then step into the green area. You're then gonna do the next foot. And you are gonna then step into the green area, and you are gonna now disinfect your gloved hands. Help you. You are gonna remove those gloves. You are gonna don new gloves. Once you have your new gloves on, you are going to remove and discard your N95. Make sure you are leaning forward and pulling up and over away from yourself. You are now going to disinfect your gloved hands. You are going to then discard your gloves. You are going to then now wash your hands with soap and water.
Thank you.
Thank you.